So, got an interesting question. Someone who has a low TSH, just below the normal range, which is usually zero point 0.5 to 5.5. This TSH was zero point 0.4, and they had positive thyroid antibodies, TPO antibodies. So, I'm going to call this subclinical hyperthyroidism, meaning that the patient has inherited the antithyroid antibodies. TSH is a little low, so eventually they could go on to develop Graves' disease. But what do you do when you have this knowledge and the patient has no symptoms, which I am assuming from this question that they had no symptoms? Because that's the first thing I would do as a physician is ask, are you having any symptoms of hyperthyroidism? Weight loss, tremor, anxiety, difficulty sleeping, irregular periods, hair or skin changes, meaning actually the hair can start looking beautiful. The skin can become very oily. So if you're having symptoms, then that leads me down a different path. But I'm going to stay with you have no symptoms. TSH is mildly depressed, meaning it's just below the normal range, and you have those positive thyroid antibodies. Well, I'm going to want to monitor you every 6 months for a few years just to see what's going on. Doesn't mean you need to see the physician every 6 months, but just going in for laboratories every 6 months. And if that TSH stays stable at that 0.4, that might be your normal. Because what we forget as also physicians and patients is that the range is for the majority of us. But there are some that fall below the range and some that fall above the range. So as a physician, I'm trying to see if you're in one of those extremities. The other thing I would say is if all of a sudden you developed hyperthyroid symptoms, that you call the physician and say, I want to get my labs checked sooner than the 6 months. So that is, let's say you got your labs checked now in July, and it was that 0.4 with positive thyroid antibodies. You're not due again until January. Come October, something's off. You just don't feel right. Don't wait until January. Call your doc. Ask to have the labs checked sooner. So just close observation is what I would recommend.